Afternoon and welcome to all of you who are joining us for the first time, as well as those of you who were able to attend the previous seminars organized by the Rutgers Science Communication Initiative. My name is Itzhak Yanovitsky. I'm a professor of communication at the Rutgers School of Communication and Information. I'm also, together with Bill Holman, a current member of the National Academies of Science, Engineering, and Medicine Standing Committee on Advancing Science Communication. And I've been working closely with the leadership of the Science Communication Initiative, Dr. Hellman, Nucci, and Ponzio, to organize this series, which is intended, just to remind you, to showcase the contributions of the Rutgers community to advancing science communication research, practice, and training, and support the growing community of practice here at Rutgers that is focused on effective science communication. This is the fourth and final event that the initiative is hosting this semester. We are looking forward to continuing this series in the spring, so please keep an eye for future announcements. The first event in the series featured Dr. Ellen Lashner, until recently the CEO of the American Association for the Advancement of Science, who spoke about the growing importance of science communication as a field of research and practice, and how it fits with the mission of land-grant institutions like Rutgers. The second event featured a panel of graduate students who discussed their experience and perspective on science communication. And the third event offered a window into teaching science communication, specifically content, pedagogy, and competencies from K-12 to college, undergraduate, and the graduate level. If you missed all or any of these, you can find videos and recordings of all of these events on the Rutgers Science Communication Initiative website, along with other useful information about the initiative. Today's seminar is on the topic of engaging diverse audiences in science communication in the wild, outside of the educational setting. We've lined up a distinguished group of panelists to share their experiences with us and invite you all to participate in the discussion by posting your comments and questions into the Q&A box, which we'll be monitoring. With that, let me hand the control over to Dr. Marian Nucci, who will be moderating the session and introducing today's speakers.
Thank you, Itzhak, and thank you, panelists, for joining us today. I'm very honored to moderate the panel, and we have with us three doctors from Rutgers, Dr. Marian Passannante, Dr. Patricia Irizarry, and Dr. Sara Elnakib, and I'm going to let them introduce themselves because they will introduce themselves much better than I can. So the way it's going to work today, our panelists will introduce themselves, talk about their work, and then we'll move to Q&A. We have some questions from the founders of the initiative and the seminar series, and then we will open it to the audience questions. So please make sure you post any questions you have in the Q&A as we go along. We will monitor them and ask them as we get started. So I'd like to invite Marian Passannante to introduce herself and tell us a little bit about her work.
Thank you, Mary. Let me share my screen. Okay, so as Mary mentioned, I am from the Rutgers School of Public Health, and oops, I'm going. All right, there. All right, so my background actually is was originally in the humanities as an undergraduate in history, but moved to public health and received my doctorate at Johns Hopkins. And really my first job was actually at New Jersey Medical School, and now I'm both at New Jersey Medical School and at Rutgers School of Public Health. At the School of Public Health, I'm the Associate Dean for Educational Program Development and Global Programs, and a professor in the Department of Biostatistics and Epidemiology. I am an epidemiologist. And in that function, in that role, I work to develop new programs, both domestically and globally. And I teach master's and doctoral students. At New Jersey Medical School, I'm a professor in the Department of Medicine, and I have taught for over 35 years the first and second year medical students, teaching them biostatistics and epidemiology. But today, I'm going to talk about the outward-facing educational experiences that I've been involved in. And so there are three in particular that I thought I would highlight. The first is Science Olympiad for high school students in New Jersey. A number of my colleagues at other institutions at Montclair State and one who is in industry worked to develop a science Olympiad event called Think Like an Epidemiologist. We ran this event for 3 years through the state of New Jersey's Science Olympiad program. And the objective of the program was to try to use epidemiology as a way to teach a scientific method. So we actually had the students who participated go through formal training, the NIH ethical training. They created a grant proposal for a research project. We critiqued it, they modified it, then they implemented the project and developed it and presented it at the Science Olympiad. The second outward-facing program that I've been involved with more recently is at the School of Public Health, where we've developed a summer experience for high school students called FOCUS, Public Health Outbreaks, Communities, and Urban Studies. And the idea is really to introduce students to the broad field of public health. We have found that most students, at least before COVID-19, didn't know what public health was, didn't know what epidemiology was, or the broad number of fields that students could go into in public health. So it was a way to expose them to that. And finally, as a result of the COVID-19 pandemic, I was contacted by the Liberty Science Center to help them to create an exhibit called Race to Trace, which was how to do contact tracing and what the impact of contact tracing is in trying to stem the COVID-19 epidemic. So I guess I could stop there, and then we could introduce the other panelists, and then we could answer questions.
Thank you, Marian. Appreciate that. We look forward to hearing more about your work. So now I'd like to invite Dr. Patricia Irizarry to tell us a little bit about herself and her work.
I'm sharing my screen. And I need to go to presenters. Can you see that?
Yeah.
Okay. So hi, everyone. Thank you for the invitation. My name is Dr. Patricia Irizarry, and I'm Assistant Professor of Professional Practice at the Office of STEM Education in the School of Arts and Sciences. And when I heard the title of the presentation was Science Communication in the Wild, I immediately knew I was going to put a bus of the science bus on this presentation, because that's been a wild ride for me. I'm a biologist by training. I came from the University of Puerto Rico, Mayagüez campus as a biologist to Robert Wood Johnson Medical School when it was UMDNJ to complete my graduate training in molecular biology. On my year three of my graduate studies, I became an NSF GK12 fellow to go visit middle schools, but I didn't know that I was going to be working on board of the science bus as a bus fellow. And that was the opportunity that changed my life around. And I, after that, decided to become a STEM outreach professional. And that's what I do nowadays. And I do want to talk a little bit about the projects that I work on regular basis. So the Rutgers Science Explorer, this is a view of the inside, is a mobile lab that visits middle schools only. So this space is designed specifically for middle schools students, and we go out around a 50-mile radius from Rutgers University to provide experiences for the students to take the role of a scientist. Again, this is the program that changed my mind and how I perceive sciences, and I'm still doing it to this day, and it's been 10 years. In addition to the science bus, I also work with the Rutgers Geology Museum. And because the topic of this particular talk was about engaging diverse audiences, I wanted to showcase that I'm not at the museum because I have any kind of geology background, but I work at the museum because I'm bilingual in Spanish, and a lot of the groups that came to the museum, they were from Hispanic communities. So this is me giving a tour to a group of students in Spanish at the Geology Museum. We are in downtown New Brunswick, and it's a free museum for anybody to come in. And we receive visitors of all ages, right? At this point, I'm not working with just middle schools. I'm working with people from all ages and families from around the state of New Jersey and other places. Then all of these outreach programs are home at the Math and Science Learning Center. The Math and Science Learning Center, as you can see here, this is the 3rd floor of the Allison Classroom building in the Bush campus. And it is our headquarters. It's where my office is when I'm not running around to a school or to the museum. And we also have an area, a demo area, where students or K-12 students can come in on Friday mornings to get tours of physical sciences. And last year, we inaugurated a space where we're calling it the Rutgers Science Explorer Station. And it's a room dedicated to do outreach or activities similar to the ones that we do on the bus on campus. So we can visit schools, but schools can also come to campus and interact with us and have a second view of what happens with this at the college level with our activities. And so with that, our philosophy is science for all, science on the move. I thank you for your attention, and you have here my contact information. We have communities that we work at in 15 counties around the state of New Jersey, and I will be very happy to answer any questions that you might have about the work that we do. Thank you.
Thank you, Patty. I appreciate that. Again, we look forward to hearing more about your work. And finally, she said she's soon to be doctor, but I think we'll just call her Dr. Sara Elnakib because she's going to be a doctor to tell us a little about herself and her work.
All right, thank you so much, Mary, for the introduction. And I just want to make sure, can you guys see my slides?
Yes.
Okay, good, thank you. Like Mary said, my name is Sara Elnakib, and I work for Rutgers Cooperative Extension. And so I'll talk to you a little bit about what that is. And I'm in the Department of Family and Community Health Sciences. And so my presentation is a little different. I'm going to talk a little bit about where I work right now, but I also tell you a little bit about what brought me to this work, because I think it's really important to put it in context. And so for those who don't know, Rutgers Cooperative Extension is the outreach arm of Rutgers University. It's basically where the science meets the people, right? And that means that there's a county office or a Rutgers office in every county in the state. So there's 21 offices in New Jersey, and Cooperative Extension is a nationwide framework. And so basically every state has a cooperative extension in its state, and in New Jersey, Rutgers houses the cooperative extension offices. And then there are 3 main departments in cooperative extension. There's the Agriculture and Natural Resources Department, the 4-H Youth Development, and then our department, which is the Family and Community Health Sciences. And in our department, we do a lot of like health and nutrition education to the public. And just so you know, the way cooperative extension is funded is very unique. It's a partnership between the federal, state, and county government. And what that means is that, the USDA, the National Institutes of Food and Agriculture provides some money to Rutgers University, which provides additional money to support our salaries. And so this unique kind of funding structure allows us to work in the community for a very long time. It makes our funding a little bit more stable, and it allows us to draw on nationwide programs and bring it to a very local level. So like I mentioned, I wanted to tell you a little bit about what brought me to this work. So I went to school on Cook campus. I graduated from Cook College in nutritional sciences. And after doing that, I did my internship to become a registered dietitian, and I worked in the clinical field. I was a clinical dietitian for the diabetes and cardiovascular disease floors. They call that Med-Surg 1. And so I was there in a small urban hospital in Newark. And it was a really difficult kind of first job for me because I found that, coming out of school, I just wanted to help people learn about nutrition, show them all of the important things they can do to take care of themselves. And yeah, despite, you know, my best efforts, despite the patient's best efforts, people would keep coming back more and more to, you know, with the same diseases, and especially with diabetes, things would progress very rapidly. And so one of the patients who would come up with an infection and ends up with an amputation that ends up with a, you know, a even bigger amputation. And so it becomes really disheartening working in that kind of environment. And it made me think and realize, you know, what education has to offer and what it doesn't have to offer. And so what I noticed is that despite everyone's best efforts, you know, it wasn't a lack of knowledge that needed to change. It was also the infrastructure and environment in which people live. And so at this time, Robert Wood Johnson Foundation was doing a lot of work around health disparities. And so I have a picture of a map here of the French Quarter in Louisiana. And so you can see that if you grew up and live in the French Quarter itself, you'll live to about the age 55. Whereas if you take, you know, if you grew up and live a few miles out, you can live up to the age of almost 80. And so this disparity allows us to see that really the environment is a key factor in our health, and the fact that, you know, our zip code is now more indicative of our genetic code makes it really important for us to consider, you know, what we need to do with some of the science that that we come across at the university. And so this graphic is from the County Health Rankings, which is part of Robert Wood Johnson Foundation's work around disparities. And it really looks at what affects health. And so usually when you ask somebody, you know, what do you think affects your health? They say something like, you know, going to the doctor, seeing my doctor. But in fact, that's only 20% of health. Health is broader than that, and things like our environment, our, you know, social economic status, things, our education, our income, all contribute to our health in different percentages. And so it's really important for us to acknowledge that, and that's the way I kind of frame the work I do around educating the community. And so two examples of that. The first is the Healthy Corner Store initiative that we did in Passaic in 2015. And it relates to, you know, the fact that we were trying to educate students in middle and elementary schools in Passaic, New Jersey. It's a small town in Passaic County. And, you know, despite our best efforts, the kids were still going to the grocery stores before school, you know, grabbing the purple juice and the hot chips and you know, kind of not listening to anything we were saying, right? And so we recognized that the issue was really that, you know, the access to healthy food. And so we went to the store owners around schools and we tried to convince them to try to offer up more healthy food. And so we did a little bit of education to the store owners, but then we really gave them the tools they needed to make their own decisions and how best they felt they can help their students and their clientele. And so if you look on the top right of the picture of the slide, you can see, or sorry, top left, you can see a picture of like cut up fruit in a cup. And so this was basically us letting go and giving complete autonomy to the store owner, because he came up with this idea of putting, you know, cucumber, papaya, mango in a cup and offering it with chili and lime, chili powder and lime. And so when he told me this idea, I was like, are you sure? I don't think that's like the most appetizing thing. Like, have you tried this? You know, and he knew his population, he knew the community, and he said, this is gonna sell. And I was like, okay, I'll support you. And so we purchased some of the produce and the things that he needed. And he was right. These things like immediately flew off the shelves. And when we interviewed the students after, you know, coming in and picking these up instead of their juice and Takis, they said that basically they were getting the same flavor profile. They were getting that salty, sweet, spicy taste that they'd get from the meal, you know, the chips and the soda. And now, but they're getting it from fruit. And so from my end as a dietitian, I am happy that the kids are eating more fruits and vegetables. From the store owner's perspective, he's selling a more expensive kind of snack. And then for the students, they're getting the same flavor profile that they want. And so it becomes a triple win. and definitely something that we counted as a success. Another program that we worked with in the community relates to trying to help schools reduce waste and increase food access. And so we taught food service workers on what they can do to help reduce waste and increase kind of the usability of different foods. And so they, like, you know, we trained them, and then they had to come up with their own plans on what they wanted to do. And so every school decided to do things a little differently. But these are some of the examples. And so offering multiple kinds of fruits, offering salads in like a convenient package. And so obviously, you know, we're doing this for environmental purposes, but if we were to choose how to implement this program, you know, putting salads in packages was not going to be our ideal, you know, way to present it, because obviously that's excess package waste that we are trying to reduce. But the idea is like really empowering the community to make the decisions on their own, and they felt like this is what they can do to help reduce waste and increase fruit and vegetable consumption in children. And so it was, it benefited the kids and it benefited the school. And even though it wasn't the best environmental footprint, it was definitely something that the community took on, which was kind of the most important thing for us. And that's kind of it. So thank you so much, and I look forward to ask your questions.
Thank you, Sarah. So at this point, what we're going to do is we're going to ask the panelists to all rejoin us with their video on, and we'll be asking a series of questions. And I'll remind you that if you have a question, to post it in the Q&A, and we will include those in the questions to the panelists. So I'm going to ask questions, and I would love it if you would all like to comment on them. So the first question is, why are you interested in communicating science to a range of audiences? So we'll go in order again as we were introduced. So Marian, why are you interested in communicating science to a range of audiences?
So, well, first of all, I just love to teach. So I think that's the first thing, is that it really doesn't matter to me what audience I'm working with. I love to meet people and to learn what they're interested in, and to try to spark some interest in them in public health. So sometimes the audiences are more challenging than others. I can tell you that over the years, medical students, when they first come in, they're more interested in medicine than they are in public health. So part of that is sort of convincing them that there's an exciting part of the field that they don't really know about that's important for them as clinicians. So that's a challenge to me. Public health students are, you know, they're a little bit easier sell because that's what they want to learn. And then really, I find that the excitement is in teaching people about things that they had not learned about before. That's why I really love teaching the younger students. Part of it, I got involved in this as a parent. I had a child in an independent school in New York City, and they asked me to come in and teach about survey research methods and about a public health topic, and also teach them about math. So we were actually doing confidence intervals and proportions and a data analysis. So to get them involved, having a survey and having the students in the school do the survey sort of drew people in. And then I got to teach them about math while I was doing that as well, about statistics. And even one of the things I did not mention is I've been working with a program called Stepping into STEM, which is a NAACP sponsored program where they have high school students from Middlesex County who I have now spoken to for 3 summers in a row. And the excitement on their face is really what sort of drives me to want to do this.
Thanks, Marian. Patty, why are you interested in communicating science to a range of audiences?
So in my case, it was not planned. So it just sort of happened for me. But first of all, as an individual, I do love to talk. So interacting with new people all the time is something that really drives my momentum and the work that I do and the things that motivate me to wake up every morning and go to work. But also as a scientist, at some point I saw the need for making younger students to be more interested in sciences, or they will say, I like science, but I they carry so many misconceptions. So as a member of the scientific community, I wanted to make sure that I had an impact in students' interest and that they will choose more careers in STEM. But also as a member of society, for the students that don't like science, I wanted to increase scientific literacy. So I really, when I go on the bus, I know that not every student in that bus is going to become a scientist. And I'm fine with that. That's okay. That's not the goal of the program. I know some of them will, and I'm happy to see them when they come to Rutgers. But the main goal, I think, is we have global issues, and we need to be knowledgeable about those issues. And the best example will be now COVID-19, right? That it affects every person in the planet. So how are we going to deal with this? What are the things that we need to learn? And so that will be my main motivation to do what I do.
Thank you. And Sara, could you tell us why you're interested in communicating science to a range of audiences?
Yeah, absolutely. And so in my position, I work in Passaic County, which is northeast New Jersey. And if you know anything about Passaic, it's very diverse. And so the main city in Passaic County is Patterson, and they speak 52 languages or something in the school district. And so it's very kind of just the innate kind of population that I work with is extremely diverse. And I think similar to what Patricia was saying, I'm an extrovert. I love talking to people, and I love showing, especially younger kids, what a scientist looks like, and how a scientist interacts in kind of the spectrum of science, right? And so we talk a little bit about, how we do research, and we do collect data on our initiatives, but that's not where everything stops. Right? It's a loop, and we come back to the community, we talk about the research we found, and then we develop more research. And so that's kind of the reason why I love doing science and communication in diverse audiences. Yeah.
Thanks, Sara. I want to start the next question and direct it first to Patty. So Patty, why is it critical to communicate science to non-scientists?
So many times when we go to schools, we see teachers, we see school administrators, we see students and their families, right? So we not only interact with just one group of people or people who are interested in science. And in my personal experience, I think I kind of answering the first round is there's a lot of perceptions, misconceptions, and need for a connection, right? We need to be able to work in the same page. You don't have to do the science, but you should understand what it is about. And the other way around is also not all scientific decisions are made by scientists. You have politicians, you have lawyers, you have people in other positions of power that can make decisions that affect what we live through. And one of if you think about innovation and research and development, the main idea is to make our life better, to make our life more comfortable, to make everybody's life a little bit better for where you are. And the more we know about it, the better prepared we're going to be for what's to come. So I think that will be my final answer.
Great, thank you. Sara, excuse me. Did I ask you this question? I've already forgotten why it's critical to communicate science to non-scientists.
No, you didn't. But yeah, I think it's really important, kind of because science touches everything we do, right? And so from the fact that our everyday health to kind of the food we eat to everything that is in our lives has something to do with science. And then on top of that, we're constantly bombarded with scientific claims, right? And so it's really important for us to kind of communicate not just science to the community, but also how to discern science and what is a reputable source, and how to look for things, really teaching them the skills to be critical thinkers. And I think that's, something that teaching science helps people develop. which is really important for everyday life and just deciphering all of the messages and everything that we kind of come across in everyday interactions.
Thanks, Sarah. And Marian, would you like to answer the question why it's critical to communicate science to non-science?
Sure. So one of the things in our public health summer program that we do, not only do we want to introduce them to possible careers and teach them about public health, but it's also about their own personal health. And when Sara showed the video, her slide, and showed the life expectancy and how it's so different just a mile away in one particular area, all of the social factors that have an impact on that are things, many are things that we can intervene on. And so if we can actually teach people to be consumers of science and public health knowledge, and maybe act upon that in their own lives, it also is very important. So it's twofold. It's not just teaching them about the career, and actually maybe more than twofold, teaching them about scientific method, teaching them about how to apply statistics to a problem, but also how it can change their lives.
Thank you, Marian. So the next question I'd like to direct to Sara, and Patty and Marian, if you'd like to answer it as well, you can jump in afterwards. But Sara, how do you decide what frame to use when speaking to different audiences?
Yeah, sure. So I teach from preschoolers to seniors. I teach everybody in the community, and so it's very, the way we interact, I interact with different community members is a little bit different based on, what their interest is. But in a lot of cases, it's really broken down into kind of three components. The first is to try to motivate them to see what is possible, right? To just show them that, I don't dictate to them, this is what you're supposed to do, this is what you're supposed to eat, this is what we know, try to just show them like the realm of possibility and why this might be important to them. And then I try to teach them a technical skill, right? So like I mentioned, discerning where to get health information, or maybe it's, reading a nutrition facts label, or trying to give them like a skill that they can actually use when they leave. And then finally, the last thing is really to encourage them and have them build their, expectation of themselves and their agency in their ability to do these things. Because I feel like, whether, we teach science, whether it's nutrition and health or whatever, if they believe they can do it, or if they believe they can't do it, they're right? And so self-efficacy, we know, is one of the things that's really, really important for people to change behavior or whatever that is. And so for us to make sure that in whatever interaction I have with whatever group, it's really focused on improving self-efficacy around health education, health and nutrition education.
Thanks, Sara. Patty or Marian, are you interested in some thoughts about how you decide what frame to use in speaking to an audience? Patty?
Sure. Yes. So in my case, it's a bit different in the sense that I see tour groups or bus visits, right? So every single time I see a group of people for this one time only, I know I only have this very short period of time to make an impact, and I'm going to go forever. It's not a class that you have for a semester, right? So I know that I only have probably 5 minutes to get their attention. And I try to see every single time that I do these kind of tours or group visits as a conversation. So it to me is a conversation. So I get in there, and although I'm giving maybe the same content, I want to make sure where you are you interested? So I always ask questions. I try to see where they are. If they're too quiet, I try my best to make sure they're engaged since the beginning, and hoping that the activity will go well, and then by the end we get some feedback. So that's something that I learned over time, because in the beginning I remember talking too technical or talking above people, and then thinking like, but they're like the same grade as this other group that did great. So I needed to learn that every group that comes in is at a different baseline. So I need to listen before I talk to be able to be productive in any session.
So Marian, I see you're nodding your head. So would you like to
Oh,
jump?
yeah. So one of the things that Patricia just said about engagement, that's sort of where I start. Like, what activity can I best engage them in that will get them involved? So, as a professor, we use PowerPoints. And one of the things we learned quickly in the focus program for the summer is high school students do not want to see PowerPoints. Right, this is absolutely not. So after the first day, we scrapped all the PowerPoints. So we try to do experiential learning, get them out into the field to see what we were talking about, what we're doing. We had sessions on public health nutrition. We had them go to a farm. We had them both in Newark as well as Rutgers farm. They cultivated some crops. So, and they learned about the importance of nutrition and the nutrients in the crops. So, getting them physically involved for high school students, I think, is absolutely important for us to be able to really make a major impact.
So I have a question from the audience, which I think some of you've already answered, but I'll ask it anyway. So the question is, what role does listening play in your communication strategies? So would someone like to jump in on that? Marian, you're on mic. Would you like to answer that?
Sure. So what we do with our focus program is we have an evaluation at the end of every day. And that is where we learned immediately that they do not want to sit and listen to us lecture to them, and they did not want to see PowerPoints. So I think it's absolutely essential to listen to the group. And I've learned over time with the high school students, particularly as stepping into STEM program as well as our focus program, is to let them tell me the experience in their lives. So when I'm talking about prevention measures, I start out by saying, how did you get here today? What did you do that might have to do with prevention, right? Well, some of them came in a car. I said, all right, well, what were you wearing in your car? And it was a seatbelt. Or did they ride their bike? And were they wearing, and tell me how you were dressed? And was there a helmet? So trying to draw it out of them, I think, is really important, so that listening, I think, is essential.
Sara, would you like to answer about listening, what role it plays in your communication strategies?
Yeah, absolutely. I think, as sometimes as a scientist or coming from a university, people are a little bit intimidated, right, by kind of the white coat syndrome kind of thing, where they're like, okay, she doesn't know my life, she doesn't know who I am, or where I come from. And so really being kind of open to people's experiences, like Marian said, and listening to them, I think is extremely important for them to start trusting you, so that they can listen to you when you have something important to say. And so a lot of times, for example, the nutrition label reading class, I always, have a bunch of boxes where we give everyone a box and ask them to stand in order of sodium from highest to lowest, and then sugar from highest to lowest, and everyone's moving around, and it's very chaotic. And then when we finally sit down, I ask them, how did that make you feel? What did that remind you of? And people start really sharing. They really open up and say, I never thought this cereal, I thought it was healthy because it has all of these labels or whatever. And so despite, I could have a PowerPoint for 45 minutes talking about, marketing and labels and whatever, and nobody would have gotten that. Whereas having them talk about their experience and make them kind of similar to motivational interviewing, right? Making them come to the realization of what I'm trying to say instead of having me say it is really important. And that doesn't come any other way without listening.
Patty, would you like to answer that question? What role does listening play in communication strategies?
Yeah, well, I think I sort of answered it before too, but we always have to listen to the groups, to the students, sometimes to the teachers, to see how is the best way to engage that particular group. I also think this has been also a learning experience for me. So I'm trying to constantly grow and learn and, be able to see what will be the next step for programs like this, because program sustainability is also a big challenge. And if you're not able to listen, if you are just in one direction and you just want to do this, it is harder for you to be successful. So listening at all levels, right? From when you're thinking about strategic planning for your program, or when you're thinking about how I'm going to convince this teacher to let me into her classroom, or how I'm going to address the students. It is, I would say it's 50%, right? 50% talking and addressing the students, and 50% listening to what they need, so you are successful.
Thank you, Patty. So let's take this a little broader and ask, what are key strategies to effectively communicate science to non-scientists? So, Sarah, would you like to answer that, or?
Sure, yeah. So I think some effective strategies are really building trust. You know, I think, you know, people will listen to you more if they trust you. And I think, I also listened to some of the sessions from before this communication session, and I loved, you know, Dr. Ellen's presentation about, you know, how we have to be very respectful of people's beliefs and their, you know, what their current status is, and so meet them where they are versus just tell them, you know, this is how you have to be, or this is what it is. And so I think that's a really important kind of practice for us to do, to be effective in science communication, is you know, absolutely, you know, being aware of where people are and trying to meet them where they are, as well as building trust between, you know, you and the individual, so that they're more willing to listen, whereas you know, and trust you to make the right, you know, choices.
Patty or Marian, would you like to add anything to this conversation about key strategies?
Sure. So in my case, it's really important to set the foundation and develop a relationship with the schools. And I say this because after a couple of years going to the school, I know something's going to happen, right? I'm going to be stuck on the turnpike under a bridge, or I'm going to be in the middle of a snowstorm and I'm not going to make it. So being able to have a strong relationship, that they trust you, and that they are not only that I have to be flexible and adaptable, but then that they also want to work the same way with me, is very important. And so I always have to just be prepared, right? I need to be prepared to do whatever it takes to make sure that program is delivered, whatever that means in this wild world, right? So yeah, foundation, relationship, and flexibility.
Thanks, Patty. Marian, anything else you'd like to add to this?
So just to echo what Sara said about meeting people where they are, and really listening to the things that concern them in the population in which they live, and the groups that they grow up with, to try to answer questions that are of importance to them.
Well, then that leads me to the question that, is there a baseline knowledge that your audiences have to have in order to understand science?
So I'm going to volunteer to start because I thought about this question a little bit, and I'm going to say no. Okay, I really think that you can introduce this. I actually did a hypothesis testing experiment with my daughter's first grade class. And the question was, the teachers said the students had read somewhere that on the vernal equinox, and you could hope an egg would stay upright. So we said, okay, well, what's the hypothesis? And how can we test the hypothesis? And we went outside. We were living in Manhattan, and we went outside on the sidewalk, and we tried to test the hypothesis and see what happened. And they totally were so excited about this. You know, we didn't do any very sophisticated statistics, but they understood the concept of trying to come up with a research question and trying to test it empirically. So I don't really think that I think you just have to meet them, as we said, meet them where they are, and do it at a level that they can understand.
Okay, Patty, Sara, you want to comment on that?
Sure. So in my case, my work is to develop programs that they understand, right? So I don't think they need a baseline knowledge. We try to develop our activities for families, for people who have no knowledge, to spark that interest, and then hopefully they will get that curiosity to then go to another program. Or if we visit you in middle school and you want to come to Rutgers for one of the high school programs, right? So in our case, we focus on sparking interest to build that knowledge. So no need for any background.
Yeah, and I would definitely echo what Marian and Patricia said. I think, we are curious beings, and scientists are curious, and so people understand, that scientists is basically trying to answer this question, trying to figure this thing out, and I think in general we try to meet, make sure that in any education we're giving, we're trying to really provide all of the background and anything that they need. And like we relate it to something that's very relatable to them, right? So our bodies are science, our environment is science. There's so much science all around us that is real, concrete, that it's easy to kind of connect it to something they know without having to go into the abstract too much.
Thanks, Sarah. Thank you, Patty. Thank you, Marian. A little bit different direction. So we'll start with Sara. Sara, what are your goals when you communicate science to diverse audiences?
My main goal is really to inspire people. I know that sounds like mushy and not concrete, but it's true. I just want them to be interested in what I'm talking about so that they can, look into it in the future. And I think if I have a longer period of time with them, then I want to teach them a skill. And so really that's what all of my programming boils down to. It's to try to get them interested in the science or interested in whatever I'm talking about, and then trying to teach them a skill which they feel confident in kind of applying. So whether it's critical thinking, whether it's analyzing data from again labels or whatever, making sure that they can know that they can do this on their own.
Thanks, Sarah. Patty, how about you? What are your goals when communicating science to diverse audiences?
In my case, it is access, right? I want to provide access to people. So if you haven't seen a lab, I want to bring a lab to your school. If you have not been to a museum ever in your life, I want to bring you to our museum. If you are participating of an activity and you don't understand because you don't speak the language, I want to be able to translate for you and make sure that you understand what you're doing. And those are experiences. I mean, these goals were not part of my career track ever before, right? I learned this as I went through, right? As a fellow, I was on the bus and I was with kids that were talking in Spanish, and they were, what are we supposed to be doing? And the other one would say, oh, I don't know. I didn't understand anything of what they said. So then I started translating for them, and they were surprised that, oh, you can understand me. So a lot of these, I learned again along the ride that of my short career, but those have become my core for whenever I develop any program. I want to make sure that whoever comes to our events or our activities or participate of anything, they leave with the feeling that I belonged, I learned, and I understood what was happening and what was expected from me.
Thanks, Patty. Marian, anything to add?
Sure. So I think what's most important to me is that at the end of a program that the students can make connections. So they not only learned a skill, but they can apply it in a different setting. So they see that it's something not just to learn one day in class and that's it, but that what they've learned they can apply over and over again. So for example, the whole idea of critical thinking and being able to read something that's in the newspaper about COVID-19 or about influenza. So one of the examples we used with the students was the 1918 influenza outbreak and how vaccines can break the cycle. So to be able to learn that, and then I know they're applying it right now when they're learning about COVID-19 and reading what's in the press, what's on the internet, et cetera. So if they can make those connections, I think that's really very important to me.
Those are fantastic answers. Thank you. So, so now you've given your programs and you're done for the day and you get to go home. So how do you know whether your outreach is effective? So Sara, we'll start with you.
Sure. So I think it depends on how much exposure they had to the program, right? So if it's a one and done type of program, my expectations are very low, right? I'm not expecting that they learned everything they needed to know about nutrition or anything in this one sitting, right? This is just, for me, I just want to know that they will, possibly engage in this activity in the future. That's it. Intention to change is enough for me at that point. And so we do post assessments and we follow up with people just to see if they have the intention to change. And then in maybe 6 months, did you actually partake in the activity that you said you would? And then for the kind of more environmental type of work that we do, so like the corner store initiative or the healthy schools initiative, things like that, we really do a lot more like numbers and cents kinds of analysis, right? And so for for the food waste initiative, we counted how much food was wasted before and after, and how much was donated because of this program. And so we calculated the difference it made. And then for the store, the corner store, we actually calculated how much money they used to make from unhealthy food, and now how much money they were making from the healthy food items. And so to kind of and we bring that back to the community. So it's not just like us having it in a journal or having it in a, in a report that collects dust. We actually show that to the community and ask them what they think. And then we revise it, revise our methods, revise our work based on what they say. And so that's the main way we collect data on our outreach. So I think it depends on how long the exposure is, and then also what our intention for the activity is.
Great. Anyone else like to comment?
For us, it's also post assessments. Just like Sara said, we know that we do one-time intervention. So it's short. We're probably not gonna change a lot of perceptions on the student, but we can change some perceptions on the students. I can also think about our late night events at the museum, right? And in our case, one of our filters is, do people come back? Do schools call us back? How many times do we go to a school? We have schools that we have been working with them for 10, 12 years. We have other schools that they just call one time and maybe they won't return. So we want to know why. So we are always in contact with the teachers and the schools. And the third part will be our graduate students, right? The people who are part of the team. We want to make sure that they have a good experience that is valuable for them, that they learn what they need to learn. And that is a more intensive pre and post surveys, and all of the evaluation process is more rigorous that way.
Okay, thank you. Marian.
So we too do evaluations. As I mentioned, we actually do evaluations most days of our focus summer program. And we want to see if there's, how knowledgeable they are about public health after they've done the program, of their intention. These are high school, anywhere from 9th to 12th grade. So some of them are going to major in college, and have they thought about public health as a career? We're actually publishing our work because other schools of public health have heard about what we're doing. I actually got an award from the American Public Health Association Epidemiology section for the program.
Congratulations.
So thank you. But lots of people involved, not just me, but my colleague Laura Liang and I developed it. But it's all run by faculty who are at the school. But I think that if we can disseminate it, and now we're actually going to do another IRB so that we can follow the people who have been in the program, that now that they're out 2 or 3 years, to see how much impact it's had on them. So trying to disseminate the program is also one way for us to see how, see if we can get that kind of an impact nationwide as opposed to just in New Jersey.
Wonderful. Well, I have a question from the audience, which you may have already answered, but I'm going to ask it in the way the person wrote it. So the question was, these programs seem like great opportunities to conduct research on their effects on students / communities. Have you been doing this, and how can public health researchers collaborate with you?
As I mentioned, yes, we have been doing it. Okay, it says I'm muted. Can you hear me?
Yes.
Okay. So as I mentioned, we have been evaluating it. We would love to have additional public health researchers involved. During the week that we have the students, one in Newark and one in Piscataway, we have a global public health fair, so they get to meet people who are working globally in public health. We have a career, speed career event where they go around from table to table. So if anyone is interested, I would be very happy to collaborate. I put my email in the chat box, and so please feel free to contact me.
Patty or Sara, you want to add anything to that?
In our case, we don't do research on the students that come on the bus. That is the way we had decided to run the program. We do have some studies and we collaborate with educational researchers, but it's not part of the main goals of the bus.
From our perspective, we always work with, public health students to do a lot of this work. And so we have a, connection with Bostein's undergraduate program in public health, where they do the field work with us. And then for the masters in public health, we haven't really received a lot of masters from public health from Rutgers, but we do get a lot from Montclair University, which is a little bit closer to where we are. And so a lot of students are, supporting behind the scenes, doing a lot of the, not only data collection, but then some of the data analysis, transcribing, things like that. And I forgot to mention this, and I feel like it's important to say, so I'll say it here. Sometimes when we do post assessments, they don't always have to be pen and paper. A lot of times, because of the educational levels, the diverse educational levels that we meet in the community, a lot of times they have to be in interviews, so we do a lot of interviews and like not really focus groups, but like just talking to the community to figure out what works and what doesn't, and it's all transcribed and analyzed in the data, because sometimes having a pen and paper evaluation becomes overwhelming for some people.
Thanks, Sara. So, the three of you are really doing such amazing work, and it's not just amazing, but it's very valuable to address social issues and needs ranging from inequality to education to access. And so my question for you is, I'm hoping you're inspiring not just with the people you see daily, but people in the audience today. So what kind of training would you recommend for someone who wants to do what you do to communicate science to the public? What do you think they should do? And I'll leave it open to anyone who'd like to answer.
I can answer that. Practice. Practice, practice, practice. And I think one of the first places to start is at home. If you're a scientist and you're always in the lab, go home and talk to your family. You can start right there. Then there are courses, events, activities, improv sessions throughout the university and external to the university that you could be part of. We have the outreach in biology class if you're an undergraduate student, so which I've been working with Marian that. And so you have ways to become a better communicator. The idea is, if you think about research, the more we know, the more technical it becomes. But at the same time, the more interdisciplinary it becomes. So you need to be a good communicator, because you're going to have to talk to people in other fields, and you're going to have to talk to people who are lawyers, and you are going to have to talk to people who are part of the community, but not necessarily experts. So start practicing. You take a course and you practice, and you go to an event and you practice, and you go home and you practice. And eventually you have your elevated pitch about your research and your science, and you will be successful on anything you want to do with it.
Thanks, Patty. Sara, Marian, would you like to add anything to that, Sara?
I'll wait for Marian to answer.
Okay, sorry.
It's okay.
Everybody's so polite.
I was going to say, I never had a course on how to teach, And in fact, as in my time in graduate school, I didn't even have to be a TA. I think I TA'd one class, and literally one class session. My advisor said, "Marian, can you teach for me today?" I mean, I had no idea. And so part of it is, I think we all three said, we love to talk, we love to meet people. Part of it's our personality, I think. But I do think that I learned how to break things down in a way that someone who doesn't have the long background, educational background that I might have in a particular field could understand a topic. So I think I learned to be a better teacher by being able to break down the important points step by step for people. And it is a process. It's learning, it's practicing. I know I keep mentioning my kids, but my poor children had to watch slide presentations and listen to me give my lectures that I was going to give to medical students. I just had the slide projector there. This was before they had PowerPoints, you know, and that's how I got to be a better teacher, is just practicing all the time.
Yeah, I would definitely echo, you know, what everyone said about practicing. I think, you know, one thing I would recommend to any student is just say yes to every opportunity. Just try to get out there as much as you can. The more you get out there, the more you practice, the better you'll be at it. And then another thing I wanted to just mention is that Rutgers is like an incredible place. So I went to undergrad in Rutgers. I did my, you know, master's in public health at UMDNJ, now Rutgers. And now I'm finishing up my PhD at Rutgers, and I have not met the same faculty member across all of those fields. It's such a vast place. So I would recommend getting out there. So if you're in communications, go take a class in like SEBS in the sciences or in public health. You know, I took some of my graduate courses in SCI, in the School of Communications, and I think it really broadened my horizons. You know, I would never have maybe thought of ethnography as a research method unless I took, except when I took it in SCI. So I think like really trying to diversify your courses, making sure that of course it counts and for school, but definitely trying to learn from all of the expertise here we have at Rutgers, because there's so many people who are amazing here that I think not enough students get out there and learn from.
We have a question from the audience asking, how have you been able to continue your outreach efforts during the pandemic, and what challenges have you encountered in doing so? And Patty, we'll start with you because you're sitting in the bus right now.
Yes, as you can see here, you're on, well, I'm trying to make the illusion that you are on the Rutgers Science Explorer, and we do, I mean, we did had Blunt Stop in March, and we were out for like 8 weeks while we regrouped and thought like, what are we gonna do next, right? You work in a museum, which is a physical place, and you go to schools in a bus, and you're not going anywhere. You're not gonna leave your house. So it was challenging, but we were able to, I mean, we have 3 incredible teams. I showed you pictures before. So we worked together, we did a lot of brainstorming, and right now at this point, we have all of our programs and events virtually happening. And we were able to expand to new audiences, which was a surprise. And so far, I mean, it is good, but I'm a people person. So I cannot do this for the rest of my life. I can deal with a year, you know. So I am looking forward to reopening the museum, going back on the road with the bus. And we will probably continue to have some virtual programs. But yeah, I miss the people. That's all I have to say.
Yeah, so I can step in. I think one thing we had to do is adjust really fast. And so we had an EPA grant that was ongoing in the middle of the pandemic, where we were talking to 4th grade kids about environmental science and how to make changes to their eating habits to affect the environment. And so we were in the middle of our education when that whole thing happened. And so we basically had all of the researchers and the people who were lecturing record their sessions, and we put them on YouTube, and we put them on a website, and we shared it with the schools right away. And then the schools came back to us and said, well, actually, YouTube is blocked. We're not allowed to be on YouTube. And so we're like, oh my gosh. And so we adjusted again and put it all on Google Classroom and made sure that all of our, questions and answers and programs were all on Google Classroom. And then they were like, sorry, we can't give you permission to, put your stuff on our Google Classroom because then you'll see the kids, personal information. And so we adjusted again and made the Google Classrooms for the teachers and had the teachers be administrators where they can copy parts of it. And then of course there's a huge digital divide, especially in low-income communities in which I work. And so one way to reach those individuals was we created grab and go kits that had mini science experiments or mini kind of projects that they can do at home while they're in the pandemic. Because a lot of it was, we were supposed to grow community gardens and school gardens, and obviously that wasn't happening. And so we gave them, gardening kits, and we gave them compost kits to take home, things like that. And then we distributed them with the meal programs where the kids come in to pick up their meals for the, week. They basically pick up the kits with them. And we found that was a little bit helpful to reach the students that we really weren't able to reach otherwise. But there was a lot of adjustments, I think. That was the short answer.
So I was going to say there are some programs that are like our focus program that we did not do this past summer because we were unable to figure out quickly how to manage. The Stepping into STEM program I did virtually with the high school students. They were on for a few hours every day, and so I did do my presentation with them. And as I mentioned initially, the Liberty Science Center reached out and said, because of COVID-19, we're going to open up Labor Day, and we want to do something about contact tracing, partly to teach people what it is, but partly to get them to answer the telephone when it rings, to understand what social distancing means. And so we did a lot of brainstorming. We used, the idea of the exhibit that we came up with is using drums and plastic balls and glow germ, and glow germ was the exposure, because we told them we were using glow germ with public health students to show them about how to wash their hands well, which we did way before COVID. We were talking about hand washing and the WHO way to hand wash. So that we brainstormed this idea, and they had two different bins, and one bin where they extracted a number of balls that had glow germ on them, so they decreased the exposure, and then had them roll the bins again and calculate the proportion of people who were exposed based upon the glow germ. So it was actually just we had to figure out how to teach people about contact tracing in a way that would be visually understandable for a family unit, which is what they figured would be coming. And then how to do it so that people wouldn't be exposing themselves to touching things, how to make this as safe as possible for people who are going to be coming to the museum in September. So it was a challenge, but it was sort of a very fun challenge for us to figure out how to do this.
That's wonderful, Marian. So we're out of questions right now, and I just wanted to see if anyone had a few last words before we say thank you to you all for giving us your time today. Anything about communicating in the wild?
If you're interested in doing this, reach out. We're always happy to work with people, and we have opportunities for grad students and undergrad students, or even if you're a faculty member and you would like to work on like a project, we will be extra happy to assist you. And again, hoping that in the fall of 2021 we will be open again. You can come and visit us. We will be extremely happy to see you.
Sara, Marian, last words?
Yeah, I just wanted to thank you guys for giving us the opportunity and the platform to talk about this. This is really important, to bring all of the science in the university out to, to the community. And I just recommend that everyone, if you're ever interested in working with the community and you don't know where to start at Cooperative Extension. Go to your, Cooperative Extension agent and say, hey, I want to teach this. Where should I go? And they have all of the connections. So you don't have to come up with them on your own. And if anyone's interested in working with me, I'll put in my email, and please feel free to reach out.
Thank you, Sarah. Marian, last words from you.
Sure. So thank you very much. It's great. As Sarah said before, Rutgers is a huge place, and that we don't often learn about what our colleagues are doing in other schools. I will tell you that School of Public Health is very active on Twitter. So if you want to learn about what we're doing and communicating, one of the ways we actually teach our students is how to write an op-ed, how to use Twitter. So please feel free to follow us. You can find me at Passannante on Twitter.
Well, thank you all very much for your time today. This was fascinating, and I always love it when I learn more about the field that I work in. So thank you so much. Great ideas, and you're doing great work. I'd like to hand it back to Itzhak Yanovitsky to close us out. We will remind you, as he will as well, that we will continue the series in the spring. The information will be available at scicom.rutgers.edu. Itzhak, thank you so much for your time today.
Thank you, guys. And I had two quick thoughts. A, that I think Sara accomplished her goal of inspiring people, because I think part of what comes through is the passion. When you have the passion for what you're doing, and you take the time to learn a lot about the audience and then recognize the needs they have, and then adjust yourself, right? The flexibility that Patty mentioned. You have to be adapting yourself to audiences and to difficulties like COVID-19. You cannot do it without having the passion and the heart to do this. So thank you for sharing that. I think the other thought I had is that when you start doing this kind of walk in the wild, you realize that communication is clearly important, but far more than that is engagement, because you all talk about the importance of having relationships and building trust. And so it requires more work than just simply communicating. There's no easy ways around that. And I think that's a kind of a message to all of us and the university, that this kind of work should be recognized. It takes a huge amount of effort to invest in time and effort in building these kind of relationships, and that should be recognized, because ultimately it is the mission of the university to do this. So thank you for that, and I want to thank everybody and wish everybody a great end of the semester and great holidays moving forward. It is V-Day and the vaccine is out, so we're hoping that that will improve. And as Mary mentioned, we're going to continue this series in the spring. We'll soon announce a new round of meetings, and we hope you can all join us and continue this, because we're trying to build this community. So with that, I want to thank everybody again for joining. Thank our panelists for the wonderful way of ending this series this semester.